Okay, so we are going to be going over the intramuscular locations on Anthony myocard here. First, we're going to be locating the deltoid location. So we're going to be looking for the acromion process, which is on the top of the shoulder here. And 2 fingers down, that is where the deltoid spot is going to be. You're going to 90-degree intramuscular right in there. Now the next location for intramuscular injections is going to be on the vastus lateralis, which is your mid-thigh. And to find that, you're going to be finding the knee and the greater trochanter here and spreading your hands apart. I have big hands, apologize, but spreading your hands apart, you're going to find that dead center there. Again, 90-degree injection right into the thigh. The last one we're going to be doing is your vestibulogluteal. And to find that, you're going to again find the greater trochanter, that little hitch in your giddy up there. And you want to use either your ring finger, or depending on your hand, you can use your first finger. You want to point your ring finger towards the belly button, or your pinky finger towards the belly button, your ring finger towards the iliac crest here. And the 90-degree injection is going to be right in the middle there. So now that we know where our intramuscular injections are, we're going to be doing one of those today on the deltoid. We're also going to be doing a subcutaneous injection here in the belly. Now I'm going to enter the room like I'm entering to check on the patient. Hi, my name is Janisa. I'm going to be your nurse today. Can I get your name and date of birth? Anthony myocard. Okay, perfect. So give me a second here, Anthony. I'm just going to check some things before hand hygiene. Open up the computer, check the MAR, see that he is due for a heparin at 5,000 units, which is 1 milliliter. And then he is also due for not a Dilaudid, he is due for Demerol. He's due for Demerol. And that is going to be at 50 milligrams, which is also 1 milliliter. So we're going to be looking to go to the med room to pull that information. So Anthony, I'm going to be right back. I'm going to go get your medications, okay? So leave, come to the med room, check the MAR again. We're looking for the 5 rights. We're looking for time, patient, medication, dose, and route. So we are looking for our medication. So we have our heparin and our Demerol. Now we need to get the correct syringes for that. So for the heparin, we're going to be using the 1 milliliter in unit form syringe with a 25 gauge 1-inch needle, and that's going to be subcutaneous. And for the Demerol, we're going to be looking at a 3 milliliter syringe in milligram form with a 1.5-inch needle at 22 gauges, and this can be intramuscular. So now that we have our needles there, we're going to get our blunt needles as well to pull the medication, and we've got some cleansing wipes. So first thing we're going to do here is clean the tops of our medications. I want to do this for about 30 seconds each. 30 seconds, let that dry, and a freshie for the next one. 30 seconds, and let that dry. Now once it's been all dried, we're going to prep our syringes. So the first one we're going to be doing here is the 3 milliliter for the, I keep wanting to call it Dilaudid, but it's Demerol. We're going to add our blunt needle here. Put this in the trash. And then with the Demerol, what we're going to be doing is pulling for 1 milliliter. So you want to draw back 1 milliliter of air and inject that into the medication. And then once you've done that, you want to pull back to the 1 and look for any bubbles, which we have 1 little bubble there. So we're going to draw back just a little bit further. Tap it, see if we can't get that bubble to center. Now that the bubble's centered, we bring it up to 1 milliliter, and that's good. We're going to recap the blunt, remove that, put it in the sharps, And then we are going to put on our intramuscular needle. So now that we have the right needle on there, we're going to label it, making sure that we have all the information on there. That way. We're going to prep our heparin, grabbing the 1 milliliter syringe and another blunt needle. And then same thing with this, we're going to draw back the 1 milliliter of air. Take that off, inject it into the heparin. And then we are going to pull back all the way back to the 1 milliliter. We might need more than that, looking at, there's one little bubble up there. Okay. Let's see if we got it right in the center. We do. Get that air down to 1 milliliter. Perfect. Now we're going to scoop our blunt and remove it. Add in our 1 inch 25 gauge needle here. We're going to label it heparin. And then we are going to either dispose of this or put it back in the Pyxis with its requirements. Because one of them's a pain med, have a second nurse watch while I dispose of it. And everything's prepared there, so now I get to take it. I should document in the Pyxis that I removed it, and then I'm going to take it to the client's room. All right, so coming here. Hi, Anthony, I'm here with your medication. Can you state your name and date of birth for me? Perfect, okay. Before I get started on the administration of these meds, I'm just gonna get your bed up to a comfortable working position for me. Okay, so this is a good height. Now I'm gonna check the MAR, making sure that I have the right time, medication, patient, route, and dosage. I'm going to perform hand hygiene. I'm going to don gloves. All right, Anthony, now that I have my gloves on, the first medication that we're going to be doing is your pain medication. We're going to do that intramuscularly on your deltoid. Do you have a preference of side? This one? Okay, perfect. So give me a second. I'm just going to expose the area. Again, finding that acromion process, 2 fingers down. This is going to be the deltoid area. We're going to do a Z-track. So we're going to pull the skin up when we do the Z-track. That way when we do the injection, the muscle locks it in place. So grabbing, checking the label, making sure that we have the right thing. Z-track here in the deltoid. Injecting it in, pulling it out, releasing the Z-track, and there you are, putting it in the sharps. Still doing okay? I know you hate needles, that's okay, you're doing great. All right, and now we're gonna do another injection in your stomach. This is gonna be subcutaneous. This is your heparin, this is for your heart. Making sure that we don't clot. So now that we've located the side, we are gonna clean the area. I just realized I forgot to prep this area as well. We should have done the concentric circle sterilization technique before injecting the medication, just like this. And we're gonna let that dry. Now that we have our heparin, what we're gonna do is we're gonna give a little pinch to the area, elevating the tissue. We're gonna be injecting it at 45 degrees. Right in there. Very good, okay. And then same thing here, we're gonna be placing it in the sharps. You still doing okay, Anthony? All right, perfect. Good, and now I'm going to dispose of the gloves, perform hand hygiene, document that I administered the medication, and then I'm going to bring his head down. All right, Anthony, do you need anything else before I get out of here? No? Okay, good, you're good. Here's your call light. If you do need anything, go ahead and press that button. We'll be right here for you, okay?